Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Abdominal aortic aneurysm surgery. Introduction. Ballooning of the aorta, also known as an abdominal aortic aneurysm, can lead to life-threatening bleeding. Healthcare providers may recommend surgery for people suffering from an abdominal aortic aneurysm. If your healthcare provider recommends surgery, the decision whether or not to have this surgery is also yours. This program will help you understand the benefits and risks of this surgery. Anatomy. The heart pumps blood to the body through an artery known as the aorta. The aorta is the biggest blood vessel in the body. The aorta branches into two main arteries called common iliac arteries in the abdomen. Each common iliac artery then divides into a branch that goes into the pelvis and a branch that goes to the leg. In the abdomen, the aorta branches out into important arteries that supply blood to the liver, the spleen, the stomach and intestines, the kidneys, the spinal cord. A normal aorta has smooth walls. Arteries with smooth walls are common in children and young adults. If the wall of an artery becomes weak, it can become less smooth and bulge out like a balloon. This is a dangerous condition known as an aneurysm. When the aneurysm happens in the part of the aorta that extends into the abdomen, this is called an abdominal aortic aneurysm. Most abdominal aortic aneurysms start below the level of the kidneys. Some abdominal aortic aneurysms only involve the aorta, but some extend into and beyond the iliac arteries. Symptoms and causes. Most abdominal aortic aneurysms do not cause any symptoms. Cholesterol deposits in the wall of the aorta are one of the main reasons the wall may become weak. Some people are more likely to develop aneurysms because of their genes, but the exact cause of an abdominal aortic aneurysm is not known. In some patients, small pieces of cholesterol from the inside of the aneurysm may break loose, travel in the blood to the legs, and cause a blockage. This can cause gangrene of the legs. Aneurysms can get bigger with time. They can also rupture or burst open. The bigger the aneurysm, the more likely it is to rupture. Patients treated before an aneurysm ruptures have a much higher success rate than those who get emergency treatment after a rupture. If left untreated, a ruptured aneurysm can cause serious bleeding and death. Patients with a lung disease or hypertension who also have an aneurysm have a higher risk of rupture. Surgery may be recommended if the risk of rupture is greater than the risks that come from surgical treatment.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatment. If the aneurysm is small, surgical treatment may not be recommended. A follow-up exam in 6 to 12 months is necessary to see if the aneurysm is growing. Ask your healthcare provider to help you create an eating and exercise plan. A healthy diet may reduce plaque buildup and slow the aneurysm growth. Exercising under the supervision of your healthcare provider can help keep your heart healthy. Refraining from smoking is essential. Healthcare providers can now place a graft inside the aneurysm without a big operation. The graft is made of a special synthetic material. It is placed through one of the arteries in the leg. After the graft is positioned in the abdominal aorta, the patient's blood flows through the stent graft. The chance that the aneurysm will rupture is eliminated after this procedure. Studies show the stent graft procedure to be safe for some patients. Other patients, however, still need a traditional surgery, especially if the aneurysm has bled. Surgical treatment. This surgery includes grafting a synthetic tube into the aorta to replace and strengthen the section of the artery that has been weakened by the aneurysm. In an open operation, an incision is made along the midline of the abdomen. The aorta is clamped above and below the aneurysm to keep it from bleeding. The aneurysm is opened and its contents removed. A graft is sutured to the aorta above and below the aneurysm. The graft is made of synthetic material that has been shown to be safe. If the aneurysm is only in the aorta, a tube graft will be used. If the aneurysm is also in the iliac arteries, a Y graft will be used. The aneurysm wall is then stitched closed, covering the graft. In endovascular surgery, the graft is threaded from an artery in your groin up to the aorta. Then the graft is opened and fastened to the aorta. After the procedure, your healthcare provider will tell you how long you are likely to stay in the hospital. This depends on several factors such as your age, your medical condition, the type of operation, and whether the aneurysm has ruptured. Depending on how quickly you recover, you may go home within a week. Risks and complications. This operation is safe and tends to be successful. There are, however, several risks and complications. These are unlikely, but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Some risks and complications are seen mainly in the open operation, while others are mainly seen in the endovascular procedure. Your surgeon can give you more details. The risks and complications include those related to anesthesia, those related to any type of surgery, and those related to aneurysm surgery. Anesthesia is safe, but the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is important to let your healthcare providers know if any of these symptoms happen. Sometimes the shortness of breath can happen without warning. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. If a deep infection happens, the graft may need to be taken out and replaced. 2. Bleeding, either during or after the operation. This may require blood transfusions or another operation. 3. A skin scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Complications include sexual dysfunction, kidney failure, death of the bowels, also known as gangrene, gangrene of the legs, and spinal cord stroke. The nerves that control erection and ejaculation may be closely attached to the aneurysm and may be divided during the operation. This could result in problems with ejaculation and erection. The following organs in the abdomen and legs are close to the surgical area. They may be damaged directly or their blood supply could be affected. The abdominal organs, such as the liver, stomach, and intestines, including the small intestine and colon, could be damaged. The kidneys, the bladder, and the tubes that connect them could be injured. The internal female organs, such as the uterus and the ovaries, could also be damaged. There is a rare chance of spinal cord stroke, resulting in paralysis of the legs. Nerves going to the legs could also be affected, leading to paralysis and decreased sensation. Treating these rare complications may require other operations. However, the damage could be irreversible and permanent paralysis or death may result. The graft could also become clogged in the future. Hernias through the incision or incisions are possible. This happens when the internal wall of the abdomen is weak and the intestines push under the skin. This may require another operation. Rarely, some plaque or debris from the aneurysms can go to the arteries in the legs and block them. If this happens, another surgery to reopen these arteries may be needed. Your healthcare provider will tell you how long it will take before your incision is completely healed and when you can go back to work. This depends on your age, type of work and medical condition, as well as other factors.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. If the wall of an artery becomes weak, it can become less smooth and bulge out like a balloon. This is a dangerous condition known as an aneurysm. When the aneurysm happens in the part of the aorta that extends into the abdomen, this is called an abdominal aortic aneurysm. If the aneurysm is small, surgical treatment may not be recommended. A follow-up exam in 6 to 12 months is necessary to see if the aneurysm is growing. Aneurysms can get bigger with time. They can also rupture or burst open. The bigger the aneurysm, the more likely it is to rupture. If left untreated, a ruptured aneurysm can cause serious bleeding and death. Healthcare providers may recommend surgery for people suffering from an abdominal aortic aneurysm. This surgery includes grafting a synthetic tube into the aorta to replace and strengthen the section of the artery that has been weakened by the aneurysm. This operation is safe and tends to be successful. There are, however, several risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Studies show a stent graft procedure to be safe for some patients. Other patients, however, still need a traditional surgery, especially if the aneurysm has bled. Ask your healthcare provider to help you create an eating and exercise plan. A healthy diet may reduce plaque buildup. Exercising under the supervision of your healthcare provider can help keep your heart healthy. Refraining from smoking is essential. Thank you for using Explain.